It is our healthcare worker and their team heroes who helped contain the COVID-19 pandemic. You cannot see the virus, but you can feel it.
Today we take the time as a team to invite the Lord's blessings on our month-long celebrations in honor of all healthcare workers and on the heels of a very, very challenging last 2 years. There's never been a better time, we believe, to show appreciation for our healthcare workers. The Ministry of Health and Wellness joins a proud nation in expressing thanks to the team of some 25,000 for their committed service to the people of Jamaica. We are pleased to dedicate the month of July to you, healthcare worker, in expression of that gratitude.
We're appreciative for the blessing and grace of the Almighty for bringing us together as one body, representing the public health sector of Jamaica. We have survived many storms and certainly we have overcome.
I'd like to take this opportunity to congratulate and to big up all the healthcare workers across Jamaica. You have done exceptionally well.
You are real heroes throughout the past 30 months. I just want to commend you and to congratulate you.
We appreciate you, we love you, and we thank you.
I implore you to use the opportunity this month of July to enjoy all that we have put together to appreciate your very commendable efforts in healthcare over the period. Thank you.
The Health System Strengthening Program is improving health facilities across Jamaica.
Building a better public health system with comprehensive services.
New and upgraded hospitals.
New and upgraded health centers.
Modern medical equipment.
Digital records.
And the introduction of telemedicine services.
Quality healthcare for all Jamaicans. The Health System Strengthening Program.
Building a better public health system for healthy people and a healthy environment. A message from the Ministry of Health and Wellness.
Testing. I'm good, right? Phase 3? Yeah? Okay. Minister? Minister Tufton. Should I go ahead? Yeah? Okay. All right, no problem. Ladies and gentlemen of the media, members of the public joining us online via our social media pages, team members here at the Ministry of Health and Wellness, also some of you present in the room, others online, good morning. My name is Petre Williams-Rayner, and I am the Manager of Public Relations and Communications here at the Ministry of Health and Wellness. And it is my pleasure to, one, wish you compliments of the season and to welcome you to what we anticipate will be our final press conference for the year 2022. We are led in today's presser, as is customary, by the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, who is supported by Dr. Jacqueline Bisesa McKenzie, the Chief Medical Officer, Dr. Ardeen Harris, the Acting National Epidemiologist, and Dr. Melody Ennis, our Director of Family Health Services, who is joining us online. I also want to recognize some of our other technical team members who are present with us today. Dr. Nadine Williams, who is right up front, our Director of Health Services Planning and Integration. Dr. Judith Leiber, Director of Child and Adolescent Mental Health. Dr. Nicholas Skiles, seated in the back, our Director of Non-Communicable Disease and Injury Prevention. And Mr. Howard Lynch, our Chief Technical Director with responsibility for policy planning and development. Welcome, 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 everybody. At this time, I invite the Minister to bring his opening remarks, to be followed by a presentation from Dr. Harris.
Okay, thank you very much, Petre. Good morning, everyone. Good morning to the team at the Ministry, to our specially invited guests from the media, and to those online. First of all, let me just thank all of you for coming online. This is, unless there are emergency matters to tend to, or urgent matters, which requires another gathering of this kind. This we hope will represent the final, the last press brief for Mike. It's not on? Okay, all right, so start again then. I know there was something wrong with the red, the green always allows you to communicate. All right, so good morning again. Now that you're hearing me, I want to welcome all of you to this, which we hope will be the final press brief for the year 2022, unless, of course, there's a need to communicate in this fashion with the public in the national interest. So let me use the opportunity to thank all who have participated, supported, being critical stakeholders of public health over the past year. It's been a challenging year, challenging few years, but we are here to tell the tale. And I think that overall, despite the setbacks, despite the challenges, our country, our people are better off today, both in terms of knowledge, in terms of infrastructure, in terms of some of the efforts that we have been attempting to make in the interest of public health. So I begin with a word of thanks and also a word of gratitude, because God has been good, and we give thanks for that. So customarily, we have this briefing to give a few updates on what is happening, look forward in terms of the rest of the year, the few weeks, a time when we not only reflect and rest, but we are quite festive. And this does have an impact on public health and on the infrastructure of public health. Overindulgence is normally allowed or catered to during this time of year. And the accident and emergency room in our hospital system across Jamaica normally feels the impact of that, as well as our inpatient care or the need for additional inpatient care. So part of the discussion is to try to just encourage persons to attempt to, enjoy, relax, do what you do, time with friends and family during the season, but be very conscious of the realities of our environment, the realities of our bodies, what we can do and what may have impact on us. And hopefully that will play a part in us just thinking through what we do and acting in as responsible a way as possible. So I want to begin with an update on COVID-19 and monkeypox. We continue our efforts, of course, to curtail the spread of COVID-19 and monkeypox. and monkeypox has been renamed by the World Health Organization as Mpox. That's a capital M, capital P-O-X. Both viral diseases have placed demands, of course, on us here in Jamaica and on the public health system. Luckily for us, we're seeing low numbers in both cases, and that's a positive thing. By way of update, we continue to capture and monitor the COVID-19 infection through our National Surveillance Unit. In October, we had discontinued the daily reports that were issued for almost 2 years. And we did so because we felt that it was necessary so to do. We know that we attracted some criticisms by a few vocal voices that we should continue. But, you know, we have learned a lot from the experience. And I think we have been able to manage the process to a point where we could give periodic updates and also sort of reduce the sort of perception around panic and national emergency which COVID once represented, which no longer is the case, despite the fact that we have to still be cautious. So we publish the numbers through the ministry's surveillance bulletin, and persons can access data there. And in addition to that, we use the social media platform to give weekly reports. Over the course of the last week, for example, that's December 6th to 12th, we confirmed 42 new cases, bringing our total case count to 152,711. Regrettably, we also recorded 5 deaths that occurred between December 2020 and October 2021. The total deaths for COVID-19 now stands at 3,452, with 349 still under investigation and another 295 noted as coincidental COVID-19 deaths. Over 7-day average positivity rate is 2.8%. On the issue of, well, when I ask our CMO and our representative, Dr. Harris, the medical epidemiologist, to comment, I think they will comment a little on what is happening in COVID globally, because we are observing and monitoring some of the developments on the global front where increase in cases have caused some restrictions to be reimposed. But let me just advise that at this point in time, we certainly don't see the need to impose restrictions here, but in keeping with the approach to monitoring these things, we will continue to monitor and to consult with our partners, as well as to assess internally, and then provide advice, of course, to the government as the case may be. But as of now, we continue on the trajectory on which we have been moving in over the last number of months. On the Mpox numbers, it currently stands at 18, with 1 active case. We note that 16 of those cases were transmitted locally and 2 were imported. And we will provide further details, Dr. Harris, on that. What it means is, again, we have the capacity, as demonstrated, to diagnose, recognize those cases, but also to treat with those cases. And 16 of the 18 were locally transmitted, which is always a cause for concern, because it means we have to do contact tracing in the wider population, at least where those persons were in contact with other persons. But the fact that we have had significant recovery is an indication that the ministry and the team would have done what needed to be done to address and to control that issue. So I'm going to ask now Dr. Harris, or a medical epidemiologist, to comment a little more on those 2 issues quickly.
Okay, hope you can hear me. So the slides should be coming up. But now I'm going to reiterate what Minister already said. We have, as it stands, over 152,000 confirmed cases, most of them, the overwhelming majority, being locally acquired. And our case fatality rate, which is the proportion of deaths to the number of cases, stands at 2.3%, and the mortality rate, 127.2 per 100,000 population. The 7-day average positivity was 2.7%. Next. The point from this slide is to note that it's the younger population that's primarily affected in terms of acquiring the infection. So if we look between the 20 and 60 years age group, that they account for about 70% of the cases that we have seen. In the next slide, it should come up, you'll see in terms of the case fatality rate, it does increase with age. So it's the older population that we're seeing more of the deaths in, such that if you look at the 90 years and over age category on the right, you see that about 20% of those who got the infection would have died. Next. Looking at the spread across the island, out of 783 communities within the island, we've seen in the last 2 weeks confirmed cases in 48 of those communities, so 6.1%. And you can see in pink, those are the communities, and they're just scattered across the island. So mostly in the island, more in white now. So the spread within island right now is quite low. And you can see the spread we're at in the green level now. So it's a comfortable level that we're at right now. For the deaths, primarily in terms of numbers in Kingston and St. Andrew, St. Catherine, and the western parishes. And if we also look at the death rates, it's higher in the western parishes than in the eastern parishes. Looking at the hospital admissions, they are at quite low levels now, much lower than the number of beds that we have allocated for COVID-19. And so over on the right, the 7-day average for the admissions in pink, you can see is quite low and has come down since the 5th wave. For the mean reproduction rate, which is the average number of cases that are confirmed from average number of contacts that are confirmed from one confirmed case, we have in pink for the cases, we have 0.8. So it means that the number of cases is decreasing, and for the admissions, it's at 1, so that has remained fairly constant. This shows for the parish curves that the number of cases is quite low for all the parishes, and they mirror the national picture. Looking at the bed occupancy, again in green, such that we consider that for the bed occupancy, it's at a level where it would exert low pressure on the healthcare system. For the positivity rate, we're seeing an average weekly positivity between 2 and 3%. And you can see there the waves where we went in terms of positivity for the waves. And I'll just pause to mention here about the variants that we have seen. So for the first wave, we would have seen the original strain of the SARS-CoV-2. Then for the second wave, we had the Alpha variant. We also saw the Delta variant for the third wave, which had quite a high number of cases, and also the severity of the cases for the Delta variant was quite high as well. Then we had the fourth wave where the Omicron variant predominated, and we had quite high number of cases in terms of the transmission across the island, but we saw where the Omicron variant was not as severe, so we didn't have as many deaths as we saw for the Delta wave. Then we had the Omicron subvariants coming up now in the fifth wave, and we can see in the next slide where we had other variants in between, but not as severe as to cause quite significant increase in the number of cases, hospitalizations, and deaths. So Jamaica does do genomic testing on the samples that are confirmed for COVID-19, and we did pick up where we had the Alpha, Delta, the Omicron, and last we saw was the BA4 and BA5 sublineages of the Omicron variant. And we know that there are other subvariants of the BA5 circulating, the XBB that's circulating. We also have the BQ1 that derives from the BA5. And so these are circulating. We know the waves are usually heralded by new variants that emerge. And so we are monitoring what is happening internationally so that we can be on alert. For the deaths that were confirmed since the vaccination program started in Jamaica, we're seeing that the majority of them, over 96%, were unvaccinated, another 2.3% fully vaccinated, and 1.1% partially vaccinated. And for the population, in terms of the coverage, what we're seeing now is a coverage of 27%, 27.2%, and of those, another 5% would have received the booster. Okay, say St. James, St. Anne were the ones that had a higher coverage, over 30%, but St. Thomas still low coverage at 16%. And we're seeing the 60 to 69, 70 to 79 age group. Those are the age groups with higher coverage for Jamaica. And for the male to female ratio, more females than males have received the vaccination. So overall, when we look at the picture for COVID-19, we're seeing low level in terms of spread, also low level in terms of the transmission and bed occupancy, and for the reproduction rates as well. However, for the vaccination level, that also remains low. That one we want to be high, the others we want to be low. So to look at the other respiratory viruses that are circulating, we're seeing an increase in acute respiratory infection. You can see we are in the flu season, and for Jamaica, usually starts in October, continue to the end of the year and into the following year, going into March. So we are confirming we are in the flu season. So we do expect, and we are seeing an increase in the number of admissions for acute respiratory illness. And it's mainly seen in the 2 to 4 years age group. That's what we are seeing in country. Also for the 6 to 11 months. Older patients as well, but not as much as the younger age group. So we're seeing also that these cases are requiring admissions. So the pneumonias and so on, what I'll explain. For the influenza-like illness, these are persons presenting with respiratory symptoms but not requiring admission. We are seeing an increase, but it's within normal limits, both for the under 5, the 5 to 59, as you can see here, and the over 60. We are seeing an increase, but within normal limits. So what is causing this? COVID is still circulating. You can see in gray, we are seeing the cases of COVID. But in addition to that, we are seeing influenza A, and primarily the H3N2, which is a seasonal influenza, and a few cases of the influenza A, H1N1. We have identified cases of the respiratory syncytial virus as well in the children that were tested in a few cases. For the Mpox update, Minister already said we have 18 confirmed cases, of which 16 have already recovered, and we're seeing more males than females, 17 of the 18 males and 1 female, and primarily that's 9 of them, half of them in the 30 to 39 years age group, so younger persons more affected. And the parishes, more in Kingston and St. Andrew, 10 in Kingston and St. Andrew. We have 2 each in St. Elizabeth, St. James, and Clarendon, and 1 each in Manchester and St. Catherine. The symptoms is as we would expect, mainly rash, fever, lymph nodes, headache, muscle aches, joint pains. So what we see in our population is what we would generally expect. So what can we say? We are in the influenza season. We have been seeing an increase in respiratory illness and admissions for this as well, mainly in children, and we are seeing those who don't require admission an increase in that as well, but that remains within normal limits, and the viruses that are circulating that cause the respiratory illness, that's SARS-CoV-2 for COVID-19, influenza A, and the respiratory syncytial virus. So, of course, we want to promote prevention, and we know that we have the COVID-19 vaccine, we have the influenza vaccine that's available. We are in the flu season, so we're encouraging all the eligible population to make them to avail themselves of these vaccines, and especially those who are in the vulnerable population, the elderly, the pregnant women, healthcare workers, but everybody who is eligible, we're encouraging to avail themselves of these vaccines and to continue the preventative measures that we used for COVID-19, wearing masks, proper cough etiquette, washing hands, and proper hygiene. And that brings me to the end of the presentation. Thank you.
Well, this is our maiden voyage, by the way, so I want us to give her a round of applause. Dr. Harris, thank you very much. You would normally see the national epidemiologist, Dr. Webster Carr, but you have done an excellent job in explaining, and I suspect I'll see your face more frequently at these events from time to time, right? All right, so thank you very much for that, and I'm sure you'll be able to ask some questions after we're completed, but the reminders around prevention is critical. Vaccines are still available, and you can access them. If you are feeling ill, meaning the coughing, the sneezing, and so on, then it is still advisable to wear a mask to protect others from yourself is the first case. Or if you're in an environment where someone is doing that, then you put on your mask to protect yourself. And that is as true for COVID as it is for the influenza type viruses that are going around. Dr. Harris spoke to that. And, I've met a couple of persons who have been quite ill. And we had, as you know, a few weeks back, our young people, our kids, and we had to do an overflow into the UHWI, University Hospital, because the Bustamante Hospital was full. Climatic conditions, travel, people coming from abroad, this season for holidays and so on will mean a lot more interaction than normal, and the possibility of transmitting a virus that may be remote in one instance but very close during the season is quite real. And so we do advise persons to protect yourself. The sanitizer thing is dropping out of style now. Nothing wrong with walking with a little bottle during the course of the season and cleansing the hands and having a spare mask in your bag. I think COVID has taught us that lesson, and you see where we are. So it's important. The hospital capacity right now is, based on my quick consultation with the Chief Medical Officer, and the numbers here suggest that we are not full. I see a number here, 3,241 average active beds in the last 7 days, over that 7-day average period. And I think we can go up to 5,500 or somewhere in that region. I mean, give or take, because the hospitals do create space when necessary, and sometimes downsize where it becomes, from an infection and prevention protocol standards perspective, where it is desirable. But on average, between 5,500, we're about, this is like 70%, 60 high, 70. But that could fill up easily, and it depends on the institution. Last week, for example, University Hospital of the West Indies indicated to me that they were full, and they had to overflow in the COVID ward, which was a special purpose vehicle built for that. So the referral hospitals tend to come under pressure and more so during the particular period. So we want people to avoid going to the hospital if you can avoid it. And in that regard, during this time of year, we do, the clinical staff, release patients who are not critical. Sometimes their loved ones complain that, why is my relative being released when they are sick? Well, in the judgment of the clinician, if that sickness is not life-threatening and there's a need to preserve a bed for the anticipated emergency cases, which normally spike during the season, then the decision is always from the SMO and the CEO to release persons. And that is likely to happen this year again. So one needs to prepare oneself for that. If you have persons in hospital who could easily be treated at home or guided remotely. The other issue we have with hospitalization during the season would be the social cases. And again, every year we appeal around that. I've been on this job for nearly 7 years, so it's been a recurring theme this time of year. Because the reality is, part of our cultural practice is for some loved ones, guardians, to drop their relatives to the hospital, which under the Public Health Act is a place of safety. We can't put people out on the street, and we don't put people out on the street. Legally or morally, it would be a wrong thing to do. And so Jamaicans take advantage of that by dropping their relatives at the hospital door and leaving them there in order for them to have a hassle-free festive season. Now, that is not in keeping with the spirit of the season, biblically, morally, or otherwise, because the hospitals are not a babysitting or give me another terminology. It's not a daycare or a night care facility. And those individuals end up becoming part of the social welfare services, become a social case. We have to feed them. They take up a bed. The doctors still have to examine them. They need attention. And really, it deprives those who really need the attention, because they're genuinely ill, from being served. So I want to make an appeal again to the public. Make some alternative arrangement. The truth is, many of these persons have been good to you in there because more often than not, they are senior citizens who may have lived their lives supporting those who now are responsible for them. And that kind of treatment betrays, I think, the responsibility that you have. So we want to discourage that, because that is not a good practice. And if we have evidence of it, we will call you out on it. So please try and avoid doing that. I think it's important to note that. The other issues I want to comment on quickly would be immunization and coming on the heels of the COVID pandemic and the data that suggests a low take-up of vaccines despite vaccines availability. We have an issue, and it's not a Jamaica issue, it's a regional and global issue where immunization has become a point of criticism sufficient to discourage some persons from taking advantage of this very important life-saving and human development practice. Vaccines work as long as they go through all the necessary tests and are approved, and we have a very rigorous process that determines whether we import or offer these vaccines. It goes through a lot of technical examination. They work, and they have worked in Jamaica for many years. One of the reasons why our life expectancy is so high, 70%, 76 I think for women and 74 for men on average, is because our human development index is largely linked to the health response, where immunization from a toddler until adulthood has given significant protection to the population, ward off these viruses and so on that are a problem and could make our immune system vulnerable. We're going to have to do more work on reminding Jamaicans of this story. And it's something that I've discussed with the Chief Medical Officer, because there's an opportunity in the COVID experience, but there's a threat coming out of the COVID experience based on the practice and the data. And particularly as it relates to our young people, our children, preventable illnesses such as poliomyelitis, measles, rubella. We have achieved significant in terms of immunization against these things, yellow fever and so on. And it is important that we get back there. I mean, we have 95% coverage for all recommended childhood vaccines, but there was a time when we were higher. We were probably 99%. And so even a slight fall in that is concerning. Within the Americas, I saw a study that suggested it was somewhere around 80% or so. We are doing better than the region, the Americas, but we don't want to get worse than where we are, and we certainly want to keep it as high as possible. So we encourage parents, guardians to see immunization as a protective device. Ignore some of the distractions from the anti-vax movement, or if you have concerns, please ask questions. We will be able to provide the answers. And for the adults, in terms of the flu vaccine, if you can get that to protect yourself, please do, because it does offer protection. I want to turn quickly to road traffic crashes, because that is another critical public health issue, trauma cases. What the data suggests is that the significant number of trauma cases are linked to domestic violence, people who know people being aggressors with each other, blunt instruments, people using, sticks, stones, right? Of course, gun violence is quite topical because it attracts a lot more news. But the reality is, oftentimes, it is a brother hitting a brother, a cousin hitting an uncle, a father hitting a son, a neighbor hitting a neighbor, people who are very aware of each other, having disputes, sometimes over very simple things that could otherwise be solved through just conversation or mediation. Oftentimes, we don't make the link between that and the accident and emergency room. Now, the place that gives me the best brief on this is the hospital KPH, which is a trauma center, whether it is such or we designated as such in the country. You go to KPH and you ask on the statistic. Dr. Wang gave me the statistics recently. I maybe need to find it on my phone right here during the discussion, right? And the reality is that it is startling in terms of the, I'm not getting it open, I don't know what's wrong with it here, but it is startling when you break out the data and see how many people end up in the accident and emergency because their brother hit them over the head with a piece of iron pipe. And once you introduce, unfortunately, the festivities of the drinking and the herbs and the spices that we all see around us, person's judgment get clouded, and the simplest thing, unfortunately, results in a visit to the A&E. And during the festive season, we get that. The other source of that is the consumption issues. We go to the parties, we overindulge, we're on a break from work. We think it is the festive season, so the eating, the drinking, oftentimes more than you would normally end up with indigestion of one form or another that has an adverse reaction, and you end up in the thing. And then, of course, the traffic accidents, which is a big concern. You may have seen that this year, according to Jamaica Injury Surveillance Survey, the period 2016 to 2020, and in 2021, the month of December, on record, has the most road traffic crashes. So it's worthy of comment and emphasis, because this is the season, this is the time. when we not only bring joy to each other, we bring pain and suffering because loved ones lose their lives or limb and end up in the hospital. That's the reality. And I think it's important that the country recognizes that. And there is a critical link to that, substance use, and obviously to health services. Data, for example, from the National Drug Household Survey conducted by the National Council on Drug Abuse, which is our agency, suggests that 12 to 65 years, 1 in every 6 males, 1 in every 17 females admitted to driving under the influence of alcohol or illegal drugs. So you're talking about 15% or thereabouts. But during the season, that tends to increase. So we really want to use the opportunity to emphasize to persons of all ages that you should really make an effort to obey the road traffic signs and rules, speed limit, designate a driver if you're going to a party. Because we understand you go to your session, you go to your lime, you go to your drink up, identify someone who may not be so inclined to be the designated driver. It works. It works. Because that may actually result in a safe arrival. Do not operate a mobile phone or device while driving. I think most of us are guilty of that. Let's try and make December a month of focus so we avoid the possibilities of errors. And wear a seatbelt in your vehicle, a helmet when you ride. That's an alien concept to many bike riders. You go down to one of my favorite parishes of Westmoreland, our neighbor, St. Elizabeth. Those are the bike accident capital of the country. And you only need to visit the surgical wards. I was in Sav recently. Male surgical ward had 80% of the beds occupied by bike accident victims with multiple broken limbs. And 95% of the cases, they weren't wearing helmets. 95% of the cases. And it's never their fault. It's always somebody else. And it says a lot. So I think it's important, as simple as it sounds, to keep repeating that. And then the drinking, of course. Drinking and driving, we need to try to avoid that. So we have to think about the cost. We have to think about the trauma. We have to think about the impact. But we also have to think about the fact that when you get into these situations, it is the hospitals that have to respond. And we try our best, but it does create a significant backlog. And that's not what we hope to do. On the point of substance abuse, I want to announce that in the new year, the various processes have been taking place to approve a major study that we're going to do around substance abuse. We're going to focus keenly on alcohol abuse in keeping with the future plans, not too long from now, to develop a green paper for national discussion towards a policy around alcohol abuse. And I say not alcohol consumption, but alcohol abuse. Because the truth is, alcohol is heavily abused in this country, and the results are there, whether through longer-term illness or through some of the things that we have identified in terms of road accidents and so on. And that's not the only substance that is abused, obviously, but a lot of studies have been done on some of the others. This study has been approved. It's a $16 million study. It's going to be driven by the National Council on Drug Abuse. And we anticipate that the results of that study will provide for us talking points, data sets, a kind of baseline for the conversation that will take place going into the new year around the green paper on alcohol abuse, which ultimately, hopefully, will form a basis for a white paper and, if necessary, a review of legislation around alcohol abuse, whether it's treatment issues or a range of other issues, just as we have done for tobacco or are doing for tobacco. And that is in keeping with trying to push the prevention, the consumption of alcohol for minors, and so on and so forth. So that's really my overarching point sets in terms of this season. Wishing all of you a good season, but saying that from a public health perspective, let us remember that January 2023 is not long from now. We want to be here when it comes, and we want to be able to approach it in a productive way. I don't know if the CMO wants to add anything that may have been missing, or we go into the questions and then you come in after. Go into the questions? Okay. So we're open now for any questions that you have. Thank you.
Right, so Minister would have said it, ladies and gentlemen. It is time for us to open for questions. And for this, I have two asks of the media. One, that you indicate via a raise of hand your interest in making a query. And two, that once you have been acknowledged, you state your name and the name of your media house. The floor is now open. Yes, go ahead.
Good morning, Jordana Murphy from the Gleaner Company. I have 3 questions. How many doses of COVID-19 vaccines are available in the country? When was the last time Jamaica received vaccines under the COVAX facility or from bilateral partners? And
Is Dr. Ennis online?
Dr. Ennis is online.
Oh, she is? Okay. Dr. Ennis is our family medicine unit head, and she would have that kind of information. Dr. Ennis, you want to come in?
Good morning, everyone. Thank you so much, Minister. So we have over 400,000 doses of the Pfizer vaccine in country, and just under 200,000 doses of the Sinopharm, and approximately 70,000 doses of Johnson & Johnson vaccines. So we do have adequate stock, and continue to encourage persons to participate in taking these vaccines. Could you kindly repeat your second and third question for me? Thank you.
Dr. Ennis, Jordana, I think I'm going to ask you to give the second
Yes,
question first, and then allow her to respond, and then we proceed to the third, because it's a raft of questions.
okay.
Yeah, so the second one first.
Mm-hmm.
When was the last time Jamaica received the vaccines under the COVAX facility or from bilateral partners?
We would have received vaccines from the COVAX facility very early in the year. I believe it would have been about February of this year, and from bilaterals possibly in April of this year. We have received from our partners and have had vaccines in stock, and therefore we have not been actively trying to acquire vaccines, because we certainly want to limit wastage.
Now, the third question, how many doses of vaccines have been dumped since March 2021, and what is the percentage of waste against the global standard?
So we have discarded some 500,000 doses of the vaccine. The exact figure I don't have, but it's approximately 530,000, I believe, doses that we have discarded. Now, the standard for wastage ranges from 10 to 30%. Those are the international standards. And we are within range. We are just about 11% of vaccines being wasted.
Can I just say that I don't know. I don't know about these international standards, but I think it can be misleading. So we have to be careful how we interpret and apply the terminology of waste. I mean, the truth is, if you never had it, you would be criticized for not having it. And then you have it, and then you're criticized for wasting it. So I'll have the same comment on it, but just from a communication standpoint and from a public perception standpoint and from a healthcare readiness and responsiveness standpoint, we encourage the country to get vaccinated. We provide the stocks of vaccines. People choose not to get vaccinated. I don't know if you can call that waste. Maybe a good way to create the narrative to reflect accuracy is to say to the people of Jamaica, why? Is it that you're lacking information? Because we're prepared to give that. Is it that you're lacking confidence in the vaccine? Because we're prepared to provide the science behind it. The way suggests somehow that the ministry has been derelict in its responsibilities, and I really would have a difficulty accepting that, even though maybe, I am at the helm, so you may think that I'm justifying my own actions or the actions of the team, but we have done more than enough to make the vaccines available. But CMO, you may want to comment on it.
Yes, just to address this issue of wastage. So despite the fact that we have international standards, the standards apply to routine vaccination, where it is expected that when we get vaccine in country, there may be wastage for different reasons. Sometimes there can be exposure to adverse conditions. Sometimes the vaccine take-up is not what we expect and they expire. And so routinely, that is an accepted standard. I think we have to consider the COVID situation a little bit differently, because we would have been placed in a situation where we would have received vaccine more than we need at certain times because of the situation in which we receive the vaccine. So when we have a country that is, for example, donating 300,000 doses, however, we know that these doses are going to expire, whether they stay in that country or they stay here, they're going to expire, but we need to have continuity, that we do not run out. So even though our requirement may be less, we may be forced in a situation to take the additional vaccine simply to allow our population to have access. So the most important thing for us during the COVID pandemic for the Ministry of Health and Wellness was to ensure that we have vaccines so that it is available for the country to take it up.
All right, thank you, Dr. Ennis, Minister CMO. Quick follow-up, Giordano, sure.
Yes, Dr. Ennis. I just wanted to know what's the average expiry date on the vaccines we have available?
Our Johnson & Johnson will expire in September 2023. Our Sinopharm will expire just around the same time, and we have Pfizer that will expire at the end of January and the end of February next year.
All right, thank you, Dr. Ennis. Are there any additional questions? Angus, please go ahead.
The Adopter Clinic program. I think the last one was at the Kenbaugh Health Center in Point Hill, St. Catherine, West Central. And it represented the 40th adoption. I think about $175 million has been committed under the program. This is just the formal commitments. Many of the adopters have given far more based on their connection and the relationship they have built up with the facility. So for me, this program has been a success. It has done a lot in terms of engaging voluntarism, promoting voluntarism, getting the diaspora involved, local corporate entities involved, giving the staff a moral booster in that they have someone to lean on beyond just their immediate bosses in the regional authorities and so on. So that's positive. We did set a target of 100 of the 325 health centers, and so we would have 60 to go if we were to meet that target. COVID was a great disruptor for many things, including that, so that put us back. But there are a number of others on the horizon. I think they have about 10 or so more that are there, plus they're doing some other initiatives. I should add, since you asked, that the foundation of the ministry will be totally revamped in the new year, and more will be said on that. The Ministry of Finance, through consultations with the Ministry of Health and Wellness, have approved an organizational structure, a new structure, which will see more people, including HR, promotion, a number of, a larger contingent, because up to this point, only 2 persons substantially working in the unit. I think it's now it will be about 7 or thereabouts. A new office will be separate from the ministry because it has to maintain a sense of independence, although it is accountable or will be accountable. A budget. I appointed a board, and a good board with private sector and public sector personnel. And the idea is going to be to use this medium to promote the virtues of giving back, in this instance to public health or to healthcare, to promote the virtues of partnership. I keep telling people there is one health, whether you're private or public or you're an NGO, and to promote the relationships that are necessary to ensure that people are encouraged to live health-seeking lives, right? So we think that there'll be some very exciting things to come under this foundation as part of the ministry. It's going to involve promoting friends of institutions like Friends of Bustamante, Friends of KPH, and working with other localized entity and the diaspora community to broaden that. You know, their healthcare is an institution, if you look at the global standards in health and education for that matter, survives much better with a sort of friends of that institution. Health and education in particular. And I think we can do far more than we're doing now with the right focus, with the right organization, with the right management. And the Adopter Clinic is just one of those programs. So we look forward to next year.
All right, thank you for that, Minister. Any other questions from our media folks? All right, ladies and gentlemen. Okay. Yes, please. Just give us a second, Michaela.
Yes, Michaela Johnson, Hour Today. With the winter tourist season upon us now, and we'll have tourists coming into the country, is the ministry concerned that there will be a spike in COVID cases? And if so, what are the plans that have been put in place to address the issue if it should arise?
Okay, we still remain vulnerable. We have been seeing a changing in terms of the subvariants that are circulating, particularly in the US. So the Omicron continues to mutate. Right now, the variants that are present in the US will be new to our population, and if we have a lot of persons coming in, then we are going to see the population being exposed to a new subvariant. Now, it means that persons who have been vaccinated still have protection against severe illness. The studies have shown that there is still protection against severe illness from the vaccine that you have received. However, for many persons, the vaccine coverage may be waning, and so they need to go and get their boosters. We have boosters available. The Pfizer is available for boosting persons who have received either the AstraZeneca or the Pfizer as their primary doses. And so we encourage persons, especially the vulnerable population, to get the vaccine. For those persons who have received no vaccines, you still are vulnerable. You are pretty much being protected by the people who have been vaccinated and the persons who have had COVID and have had some immunity. So you remain in a very precarious position, and if you have conditions that can cause you to have severe illnesses, then you can develop severe illness with severe outcomes. So we want to encourage at this time. We do expect that there is going to be an increase in the number of cases, but the majority of the cases are going to be asymptomatic, especially, as I said, in vaccinated persons and persons who have had COVID before. But the numbers will go up, but they will remain undetected. But for those vulnerable persons, if they are exposed, they can result in problems. So get vaccinated if you have not been vaccinated before, and get your booster if it is that you have received your primary immunization some time ago.
You wanted to say something else?
That was it.
Oh, okay. All right. Anything else?
All right. Thank you for that, CMO. Any other final questions, ladies and gentlemen? All right. There being no other questions, I hand over to Minister to take the curtains down.
All right. So the only thing left for me to say is to wish you a Merry Christmas and a Happy New Year. Sorry, I can't sing it. I tried to dance the other day and everybody laughed after me. So I'll try to sing it next year. No, but I want to thank all of you for the support over the last year. The media to say that you've given the Ministry of Health and Wellness quite a bit of latitude to make its points, to get its points across. We have not always agreed, and some of the opinions have been have been far apart in terms of your own interpretation of things. But that's the nature of our democracy, and we do not try to influence editorial judgment, clearly. That's your role. But you have given us the opportunity to make our case as public health, and we appreciate that. We appreciate that because I think it has been, that opportunity is important. There's a lot of noise in the media space, as you know, because it has evolved and changed rapidly over the last decade. And so everybody is an expert, and we have had to grapple with that because it doesn't take anything but a Twitter account to tweet as an expert. And so that noise does create great challenges for us, which we have tried our best to counter with some of the science and the information that we have. I think we have to do a lot more of that in the year to come. And I think that your assistance, not to be our PR machine, but to reflect our perspective on issues. I'm sure you will have yours, and others will have theirs. But we think that the balance is what really is important. So we wish for you a good season, a reflective season, and next year we continue the relationship and strengthen it, because it is all our business, health is. And to the team in the ministry, it's 23,000, I'm told, approximately across the length and breadth of Jamaica. I know this is not a holiday season for public health. We are an essential service, but we should find some time, I think, to also reflect. I want to thank them for their efforts, thank them for what they will be doing over the next few weeks into the end of the year, and hope that we all survive and thrive in 2023. Thank you very much, and have a good day and weekend. Okay, that was okay.